Enterosgel has pronounced sorption and detoxification properties. In the lumen of the gastrointestinal tract, the drug binds and removes from the body endogenous and exogenous toxic substances of various nature, including bacteria and bacterial toxins, antigens, food allergens, drugs and poisons, salts of heavy metals, alcohol. Enterosgel does not reduce the absorption of vitamins and microelements, contributes to the restoration of disturbed intestinal microflora, and does not affect its motor function. Indications: Enterosgel is used in adults and children as a detoxifying agent. Acute and chronic intoxications of various origins. Acute poisoning with potent and toxic substances, including drugs and alcohol, alkaloids, salts of heavy metals. Acute intestinal infections of any genesis as part of complex therapy, toxic infections, salmonellosis, dysentery, diarrheal syndrome of non-infectious origin, dysbacteriosis, flatulence, food and drug allergies, hyperbilirubinemia, viral hepatitis, and hyperazotemia, chronic renal failure. In order to prevent chronic intoxication for employees of hazardous industries, professional intoxication with polytropic chemical agents, xenobiotics, incorporated radionuclides, lead, mercury, arsenic compounds, oil products, organic solvents, nitrogen oxides, carbon oxides, fluorides, salts of heavy metals. Dosage and administration. Inside, 1 to 2 hours before eating or taking other drugs, drinking water. It is recommended to take with a glass of water or dilute the dose in half a glass of water before taking. Dosing regimen for different age groups. Dosage for adults: 1 package or 22.5 grams, 3 times a day. Daily dose 67.5 grams, 3 packets. Dosage for children aged 5 to 14 years, 15 grams, 3 times a day. Daily dose 45 grams, 2 packets. Dosage for children under the age of 5 years, 7.5 grams, 3 times a day. Daily dose 22.5 grams, 1 package. Dosage for infants. It is recommended to mix 2.5 grams of the drug in a triple volume of breast milk or water and given before each feeding, 6 times a day. Dosing regimen depending on the symptoms. For the prevention of chronic intoxication, 1 package or 22.5 grams 2 times a day for 7 to 10 days monthly. Use in acute diarrhea. Dosage for adults and children from 5 years old. Initial dose 2 packets or 45 grams for adults and 1 packet or 22.5 grams for children. Then take 1 packet or 22.5 grams after each act of defecation in case of loose stools. Dosage for children under 5 years old. Initial dose 1 tablespoon, 15 grams. Then take 7.5 grams after each act of defecation in case of loose stools. After the diarrhea stops, take the drug for 5 days at the usual dosages. In case of severe intoxication during the first 3 days, the dose of the drug can be increased by 2 times. The duration of treatment for acute poisoning is 3 to 5 days. For chronic intoxication and allergic conditions, 2 to 3 weeks. Repeated course on the recommendation of a doctor. Contraindications. Contraindication to the use of Enterosgel is hypersensitivity to the drug, gastrointestinal bleeding, intestinal obstruction. Special instructions. Enterosgel can be used in complex therapy with other drugs, subject to the rule of separate intake in time, 1 to 2 hours before or after taking other drugs. Enterosgel is not contraindicated during pregnancy and lactation, breastfeeding. Use on children is possible from infancy. Side effects. When using the drug are possible aversion to taking Enterosgel, nausea, constipation, diarrhea,